Just want to say hello to all the friends and families of Blair County Head Start, and thank you for joining us today. I'm Koelle Williams. I'm the Family and Community Partnerships Supervisor, and I'm here with Amy Gorsuch from WIC, and she's here to talk to us today about what's going on with WIC right now. So Amy, thank you so much for joining us. And I would just like to start off with what's changed with WIC? How has COVID affected how you are serving the community?
So right now in Blair and Center County, we are not seeing anybody physically in our offices, but we are offering phone and virtual appointments. And how that essentially works is if you are an established WIC client with a current WIC card, you would be eligible to do all of your appointments over the phone. If you have never been on WIC and it would be your first time applying, you would have to call into the office to schedule an initial appointment, which has to be conducted virtually. After you receive your card, or if you currently have a card, we placed a drop box in our waiting area. It's right inside the front door, and it's accessible during our normal office hours. And basically, you or a trusted family member or friend, or anybody that you trust with the card, can drop the card in the drop box. We collect the cards, disinfect them, load benefits to them, and then mail them back to the participant. So that's the way in our counties you would obtain your WIC benefits currently.
Okay. And then each month when their benefits would come to them, are they automatically loaded, or do they need to come and have them? Do they need to do that physically as well?
So generally, if you're following a typical schedule, you receive 3 months of benefits on your card at a time. And so let's say if you have an appointment this month and we load benefits to your card for April, May, and June, before we mail out your card to you, we will confirm your address, and then we will schedule your next appointment for June. And if we're still operating under these circumstances in June, it would be the same situation. One of the WIC staff members would call you, complete what we need to do over the phone, and then you would drop off your card again, and we load the benefits on it for July, August, and September, and then mail it back.
Okay, great. Hopefully by June, we're able to meet with people in person.
We hope so. We really hope so.
It's everybody's hope. So
Yeah.
if the family doesn't have the ability to do like a Zoom type of interview, would you be able to do this kind of information gathering over the phone?
So most of our clients who are already established, who already have their eWIC card and have established a certification for our program, they do not have to do any kind of a virtual appointment. All their information can be conducted over the phone. The only thing that we would ask for is a valid driver's license number, basically, to confirm your identity. Your very first initial appointment, we have to actually see you and your photo ID to confirm your identity. So that would have already been done at some point whenever they initially applied before COVID hit. But anyone who's brand new to the program, who has never received benefits before, that's when you have to do that virtual appointment so we can confirm your identity. Any appointment after that, then, if we're still under these circumstances, can be conducted over the phone.
Okay. Thank you. So what can you tell us a little bit about the qualifications for WIC? What do families need? What are your income guidelines? What would families look at to see if they would qualify for WIC services?
So the best place to look for all of our information in Pennsylvania is the PA WIC website. You can literally go to pawic.com. Income guidelines are on there. Standard for a household, I did have that written down for something I did this morning, but for a household of 4, it's a little over $48,000 gross income. Any family member, well, a child under the age of 5, or a pregnant woman, or an infant under the age of 1 who has active medical assistance, we use conjunctive eligibility for that, and that does qualify them for the income part of it. So we have access to check those medical cards. So if we can confirm medical assistance, that qualifies you for the income part of it. We still ask that you provide income, at least verbally, but we can tell you that you would qualify just based on that. And really, the application process is once a year. So if someone would apply this month and qualify, we wouldn't ask you for that information again until April of 2022.
Okay. That was my next question. How often do you have to reapply for benefits? So
Yes, just generally you're coming to the office or doing a follow-up at least every 3 months. Children have to have a health eval every 6 months, but the actual application with the income part of it is once a year.
Okay. And I do know that in working with some of our families, there have been times when families have stopped receiving benefits for whatever reason, chosen to or whatever. Families, just because they have stopped receiving benefits doesn't mean that they are done forever. They can call you and re-enroll, correct?
Yes, absolutely. And we encourage them to do that. It's a pretty easy, I mean, it's never been easier really to go through the process with WIC right now, especially since we started the card. Other than getting your card to the office, I mean, really, we can schedule you at any part of the day, during our hours to do a phone appointment if you've already been on the program. And just because you may have been over income at one point, or if you were receiving benefits and maybe you went several months without getting benefits, and maybe our system termed you, that does not mean you can never apply. We encourage those families to call us again and apply, especially the simplicity of not having to bring your children in right now. We're keeping everyone safe for the fact that, you don't have to come in. We can do that all over the phone for you.
Yeah. Okay. That's great to know. So can you tell me a little bit about what kind of foods are offered? I know that there's been a lot of changes in the last probably 5 years or so. I know you've added a lot of fresh stuff on there. Are there anything different right now that we could talk about?
Well, we offer low-fat milk, eggs, peanut butter, beans, cereals, whole grains, and fruits and vegetables is in $1 amount. So typically a child would get $1 amount on the card every month. Every child gets their own food products. So it's all itemized on the printout that they would receive. So the fruits and vegetables would be the fresh products I assume you're talking about, but you can also get frozen and canned fruits and vegetables, which are very economical and easy to prepare. So that's definitely an option. There's some flexibility with that as well. And I do know, just the cost of the WIC food package, as far as a child, it can save a family up to $50 worth of groceries a month. So even a family that's receiving SNAP, that is still extra SNAP money that you could set aside for something else that WIC's helping to cover some of those other food items. So it's just something to keep in mind. It really stretches your grocery dollars a lot more if you're receiving WIC.
Yeah, that's amazing. I didn't realize it was that much. So that's really good to
know.
And I know that sometimes families talk about getting things that they may have so many things that they're allotted that they don't necessarily use. Is that a problem that families should be worried about?
Not at all. You can, and that's the nice thing about the card. With the checks, you used to get a check. You had to get everything listed on that check. You had to separate your orders at the grocery. So the fact that we moved to the card has simplified that process a lot. You don't have to separate your order at checkout anymore. You just let the cashier know you're using WIC as your first form of payment. The WIC items are subtracted, and then you pay for whatever's left over that's non-WIC. If there's something that you don't want to get on your card, if there's a food item your family just doesn't use, you're not going to eat, that's fine. Whatever's left on that card at the end of your month at midnight, it just expires. It won't carry over into the next month. But you're definitely not penalized. This is something we don't look at. We don't look at like, oh, so-and-so used this, and this last month, so we're not going to give it to them this month. Not the case. You get the same food items every month, and you have the flexibility to use whatever's on your card whenever you choose to within that time frame.
Yeah, that's really good information to know. I think and it's really nice that you can just put your stuff in and not have to separate it out, especially if you're going to the grocery store with a bunch of children. You may have 2 or 3 kiddos with you, which I have done. It's not fun, to have to separate things on top of it. That's a nice convenience.
Yeah, it's definitely simplified the process a lot.
Yes. Anything else that you would like us to know about WIC right now?
I don't think so. I just want everyone to keep in mind, as far as Head Start participants, that our income guidelines are very similar. So if you are qualifying for Head Start, more than likely your family will qualify for WIC. And to just keep in mind that we're here accepting new clients, re-existing clients, we're welcoming you to call us and apply. And like I said, right now, it's really never been easier, more flexible to get you in as far as, a phone appointment. So, I mean, we're really just looking for more of our Head Start families to come back to us.
Great. Yes. And we talk to families as much as we can about it. I think it's an underused resource. So really glad to have you join us today to clear up some questions for us and talk about, like you said, the way COVID has affected things. In some ways, it's really been a struggle for really everyone in so many ways, but it's made it easier in some respects too.
Yeah. And I think really right now, you're definitely feel free to, if anyone wants to apply, call our office. We will take the information and schedule your appointment. If it's after our office hours, or maybe you just don't have time to call at that point, you can always go to pawic.com, click on the pre-application, and you can submit a pre-application online. That pre-application then will come to our county. So when you enter your address, it'll come to our county, and then we'll take that information from there and we will call you to schedule an appointment. So, I mean, that's a really easy way to do it, 24 hours of the day, really. You can do that anytime and we'll get it.
Yeah, which also happens with young children. Sometimes you're up in the middle of the night.
I know.
That's nice.
I get a lot of, most of my stuff I get done after my kids go to bed at night.
Right. This is a mom's world.
So yeah, I mean, if your kids are in bed and you see this video and you're thinking about WIC, go to pawic.com, submit that application, that pre-application, and it'll come directly to us and we'll be able to call you from there.
Great. Thank you so much. I really appreciate you taking the time to talk with us today, and hopefully we'll get some families coming your way.
That's great. We're looking forward to it. Thank you.
All right. Take care.